All right, hello, you YouTubers out there, all you fellow badasses. Today we're going to do a brief tutorial on how to do an IV on yourself. The law is pretty specific that if you're not a trained professional, you're not a paramedic, a phlebotomist or something, it's not legal for you to perform anything that requires a needle or syringe or specifically an IV on another person. However, it does not prohibit you from performing one on yourself. As you may or may not know, I'm a former 18 Delta Special Forces medic, and I've been doing IVs on myself since I was 21 years old and drinking too much. I had to go to work the next day. It is an essential life-saving skill. It's a little intimidating at first, but if you bear with me, you practice it once or twice, you'll see it's actually very simple. And like I said, it's an essential life-saving skill, especially if you're outdoorsman, backpacker, hiker, fisherman, hunter, you love off-roading, hot Arizona desert like I do. It can and will save your life. There's a lot of places in this big old country of ours still where 911 won't get you in time. God bless them, but they can't be all places at once. So without further ado, let's go through the components of what makes up an IV kit, what you need and what they do, and then we'll dive right into how to do it. All right, so as you can see, I'm on my back porch here. It is obviously not a sterile environment. First thing you're going to want to do is when you open up a first aid kit like so, you want to find yourself some type of cloth. In this particular case, my kit happens to have these large drop cloths that are ideal, not only for creating a clean work surface, but also when you're all done, you just throw your trash in the middle of it, wrap it all up, and of course pack it out with you. So without touching the dirty surface on one side, we're going to create ourselves a nice safe little work area. All right, going into it, tourniquet, obviously. You've got some infusion tubes. This is called a transparent dressing or a frame dressing. Some gloves, some alcohol swipe, your catheter, your IV tubing. Another catheter comes in my kit so that you can practice on yourself when you're home and safe and get the hang of it. Some kits will have the injectable, retractable type. We'll go through both of those. I don't have many of these left. Once they're gone, they're gone. And then, of course, your IV bag. An IV bag, in my case, comes pre-prepped with the tape already on it. You just literally have a little friendship tag here, a little buddy tag. You just grab it and rip your tape off so you've got it when you need it, okay? And then, of course, you've got your plastic bag, which can also serve an additional table or area. First thing, of course, you want to do before we open up anything is get our gloves on. These gloves are going to be a semi-sterile glove. They're not really sterile, but they're certainly cleaner than your hands are going to be. This is a 0.9% sodium chloride injection bag. This is just basically good for dehydration, which is what we're going to teach you to do today. These are inside of a sealed bag, as you can see. It keeps it nice and sterile. Your tubes also should be in an unopened bag. This is really handy. It's just an extension, but as you'll see when you're doing it for yourself, having that extra couple inches really makes a big difference on performing it to yourself. These are the infusion style kits. These do the exact same thing. In this one, when you're done, the needle retracts in here so it's safer. Like I said, the first couple people to buy them will get those. Everybody else will get the winged ones. Honestly, the winged ones are easier to do. They just they're not as safe as the retractable syringes. And then, of course, a Band-Aid and some alcohol pad. So, all right, so like I said, I'm a medic. I am not a photographer. We're going to give this a shot. So if I have to chop it up and edit it to make it sense, we'll do that. First things first, of course, there's multiple places on your body that you can insert an IV. Top of your feet is probably a very easy one for somebody who's not done it before. The inside of our elbow, that's the common one that we've all had it probably done 100 times. It's the one that every Red Cross, blood drawer, doctor's assistant, phlebotomist uses. And it's the one that I like too. It's the least painful. When you're doing an IV, a couple things you want to look for. See if we can get a clear picture of my arm here. I'm fairly vascular. You can see you've got your main veins just kind of running through. And remember, veins run back towards your heart. Arteries run away from them. And you can always see there, anytime that there's like a Y shape, you're going to have a valve just past that. So you want to make sure you miss those valves and miss those Ys. So You know, you probably, if you can see it closely, I'm pretty scarred up right here from all the years of getting IVs. This is obviously another easy one too. We're gonna use this big one here, make it easy on ourselves. Of course, start with cleaning it with an alcohol wipe. Just get a good clean both sides. You'll notice there's 2 alcohol wipes in the pad. You want that second one just in case anything gets dropped on the ground and you have to re-clean it. I'm going to use this bigger one because it's easier for you to see the angle of injection and insertion on it. But keep in mind, these work exactly the same, and we'll walk you through those as well. So the first thing we're going to do, of course, is apply a tourniquet. I have found that when doing a tourniquet myself, it's easiest just to put one in your mouth, wrap it around your arm like so, and pump it through. Again, it's not hard. If it's still not tight enough, you can just adjust it as so. All right, well, we're gonna try this again. After reviewing the last one, I realized that the whole time I was trying to show you how the angle worked, my hand was blocking what I was trying to show you. So we're gonna try to turn it around a little bit here. Bear with me, see if we can catch this vein. There's a vein that runs right along our arm. Right here, you can see it pretty well. The nice thing about the alcohol pads and the alcohol is it kind of makes it shine a little bit too. So you can kind of get an idea where this vein's at. The nice thing about this vein also is that it's straight. When you twist your hand back in this way, so I can kind of turn a little bit this way, it's actually a nice straight shot line. So makes it a little easier to get that shot in there. And again, you can kind of see it right there. So, all right, anyway, again, same technique as before. Grab her. Okay, and just kind of get that so it's pinched in there a little bit. Pump up your hand. You can see that vein's already started to pop there. Let's see if we can maybe see a little bit better. I apologize. Again, I'm not a cameraman, so I'm going to do the best I can here with what we've got. But you'll get the point. You'll get the point. I'm not really excited about poking myself again today, but it's part of the game. So again, we're going to take this. Again, there's 2 styles. This particular one, which I'm sticking with this today, so I don't poke myself when I'm trying to show you what's going on also. But again, comes off, it's trash. You have a little white button right here. You can see inside there's a spring. This will actually, the needle will actually go back inside of this protective case once you're all done. Little hand grip here. The white part goes up. If you're ever in question or you have a brand, you can actually see that that's got a nice little bevel to it. Where's my camera? There we go. There we go. Now you can see it. So you can actually see there's a nice little bevel to it. And that bevel's always going to go down towards your skin. In this particular case, the little white button goes up. So, same thing as before. Take and clean off our area. So I can get up here again. Clean off our area. And we're going to be coming in this way. Okay? I know. Let me try to turn this around a little bit here. Okay, we're going to be coming in this way. So if you see, you've got that vein running straight through here. Oh man, this isn't easy. All right, you got that vein running straight through here. So of course, we're going to be in line with that vein. And we're going to start at an angle that's somewhere at about this, somewhere around about a 30-degree angle. Okay. And then as soon as you don't want to go in because you don't want to run through your vein, you want to just puncture a little bit. And then as you do, you're going to just almost flatten it out, and that'll slide right inside that vein. And if you look really carefully, what's actually happening here is you have the needle itself, but then there's also, if you can see it, there's this protective cover over it. That part here is soft, and that's actually what's going to stay inside of your vein, which makes it really nice for when you're hiking and moving or trying to get yourself out of a bad situation. So the best I can, I've never done this in front of a camera before and at a weird angle. We are going to do, I like to hold it kind of like a pen or maybe even like a chopstick a little bit. I can get back in that camera there. I'm going to turn as best I can. I always try to hold the vein. I'm getting a little older. My skin's a little rubberier now. You can still see, hopefully you can still see where that vein's at right there. So in line with that vein at about a 30-degree angle. It's going to pop right into that vein. And as soon as we hit it, we're going to flatten out a little bit. We're going to try to drive right into that vein. No, it doesn't look like I'm going to hit it from this angle. Kind of back it up just a little bit. I'm going to do it the way that I would normally do it so you can see that it can be done. I'm going to do the best I can with it on the camera. So I'm going to hold that vein taut. And you can see how I'm holding my catheter here. I'm going to catch my angle. And put it right into that little vein right there. At about a 30-degree angle. And then as soon as I get it, we're going to work it right into that angle and right into that vein. Cool. And there we go. And once you've got it, you're going to go ahead and push this little white button back. And you can see it's got a flash. Can you see that flash? That flash means you've got a good stick. Means you've got some blood that's flowing. Okay? Next thing you're going to do, and again, normally I will have a lot of these things open if I'm working out of the back of an ambulance or a trauma room or something. I'll have everything prepped ahead of time. But here we're assuming that we're out in the middle of a field or the wilderness somewhere, so we want to keep everything closed and sterile as long as we can. So next thing we do is we're going to grab this transparent film bandage. Again, like I said, because I'm in a dirty environment, we're going to keep it sterile and closed and tie it up until the moment we need it. Take it out of this little bag here. It's got the side that you can read. A little windy here, side you can read, side you can't. It just simply peels off of there real easy. And you can actually look, there's a little break in it right there. It's going to go towards the end of your catheter where you're going to make your connection, and then it just peels off really kind of nice and easy. And you want to hold that kind of down real quick. All right, now on the back of the bags, I prepped them already with just some medical grade, they call it paper tape. This stuff pretty much doesn't stick to anything except your gloves, so it's really nice to have it already ready to go on the back of the bag when you need it. And I just simply take it and put it on my arm. I'm going to put it again right over the top of where that plastic goes. I'm going to wrap it around my arm really tight. Okay. All right, so now we've got this thing taped up, nice and neat, sanitary, cleaned up. Literally kind of the hardest part of the whole thing is getting the tubing connected to this, because you've only got really one working hand. So of course we're going to, a little trick I learned a bit ago, we're going to take our tourniquet again. Throw a little overhand knot in it, feed it over our wrist. We're just going to kind of put it here for a second. And we're going to use the pressure from the tourniquet to keep this from spinning again. So, make it kind of tight and a little uncomfortable for just a second. It won't take long. Again, because we're in a very dirty, non-sterile environment, how I do it is I take my fresh alcohol wipe here. Of course, I'm going to clean off both ends of my tubing extension here. I got a little blood on it, from that won't matter. Clean off this end. Then I also take my little alcohol pad and put it between it and my arm. And as you can see, that creates kind of a little vapor barrier between the dirt and the oils that have accumulated on your hands since we wiped it down last. And of course, this, which is sterile. So it's going to just go in there, and it's going to turn and lock on. And with the extra little bit of grip you've got from the tape and from the tourniquet, it'll slide on pretty easy. We got it. So we'll pull this off now. And again, feel free to clean it up a little bit. That's just going to stay on there for a while, and that's going to help keep that clean. The reason that I like this extension so much is it makes the second part a whole lot easier. So we're going to open up our tubing here, and out of the tubing comes this. Now the first part of this is there's a piece on the end. It's going to come off, and this is going to be inserted inside of the bag. Now I'm not going to open up the bag today. That's pretty self-explanatory. There's two parts on the bag. There's this little valve here. You're not going to use that. The other one just pops off, like if you're old enough to remember the old Coors cans or Coors Light cans with the pop tops, the pull tops. This works exactly the same way. And then you just slide this up inside there, all the way up until it's nice and tight. And that'll sit inside of your tube, or sit inside of your IV bag. The tube will sit inside of your IV bag, just like that, okay? As soon as it does that, this little viewing glass thingy, whatever you want to call it, will start filling full of IV fluid, somewhere about between a third and a half full. Okay? Once it does that, what I like to do, and everybody will tell you their own way, there is no wrong or right way to do this. I like to slide this flow control tube down to about 6 inches from the end, 6-8 inches from the end, and then I give it a nice little slug, lock it in place, and then lock this end in place. And on this extension, you can see it's also locked in place. And what the extension does is allows me to just hold this while I'm connecting them. First things first, we're going to imagine this end is in the bag. So we're going to put it out over here. Now, we're going to take this end, we're going to go down below the bag, so all the way down here, gravity feed, and it's going to start dripping. And as soon as it does, we're going to open up this end and this lock, and we're going to allow this to run until we have a full uninterrupted flow. As soon as we have a full uninterrupted flow, which means there is no air in this line, we're going to go ahead and pinch that nice and tight. So we have no air in this line, okay? And then again, keeping this back about 6-8 inches. Just go ahead and give it a nice little snug down. That's really just so it doesn't move on you. Taking this now, again, our alcohol, cleaning it up, taking this end here, which I like to hold between my fingers, cleaning it up again, same thing as before, just slides in together, and a nice little twist, and you're all set. Remove your lock, and control your flow. In most cases, you're just going to go wide open. This is an emergency situation. So you can open that all the way open. Now again, this part is sitting inside of the bag, and if you're familiar with an IV, we've all seen it before, it's going to start dripping. And knowing that you've got a good drip means you've got a good flow. You'll also be able to see, which is going on here, I'm losing my blood here, that the blood will clear out of the line. So anywhere that the blood is cleared into the line, it will go out of the line until they get flushed out by the IV and go back into your veins. All right, fair enough. So we can keep myself from bleeding out here a little bit. We'll lock that. And we'll keep this one locked, just for purposes of explanation. So, again, this is inside the IV bag. You need to keep the IV bag elevated. A couple ways you can do that, especially if you're hiking. This bag has just a hole at the top end of it where you can put things through. Obviously, like they use them to hang on IV stands and stuff in the hospitals or ambulances or whatever. Couple tricks: run this through the IV bag, put it around your head, and go Rambo style, and just hang that IV bag off the side of your head. I've never tried it, but I know it works. I've seen it happen. What I have done is take this through the IV bag and tie it up to the shit grip in the car, the handle on the car, so that it's holding the IV bag up in the air for me while I'm driving myself to a safe place or to an emergency room for additional medical help. Okay, so again, keep this thing safe, keep this thing dry, it'll come in useful. All right, so now let's fast forward to the end of all of this. This bag's about done. It's down to the end, okay? What I like to do is I like to do it all in one swoop. So in here, you're gonna have a 3x3 gauze cloth. I'm gonna take this off here, and open it up, and I like to fold it in half, okay? Just like so. Hold that for a second, okay? This piece of tape here, it's got the buddy tab on it. Go ahead and just lift it up a little bit, okay? And just kind of, if you can, just kind of separate it from what you've got going on here. Okay. And in one fell swoop, you're going to take this, put it against here. 1, 2, 3. That comes out, and your gauze goes on. And because you still have your tape there, you can now re-tape your gauze kind of temporarily back in place. It's only going to be there for about 15 to 20 seconds. Okay, hold that for your 15 to 20 seconds. Pretty much stopped bleeding, as you can see already. Take this. This is biohazard. Here, wrap it all up together, round and round and around and around, like so. And if you remember at the very beginning, we had all of this in a Ziploc bag. Again, this is biohazard. You just want to go ahead and throw that back in that Ziploc bag so nobody else comes into contact with it. We discussed earlier, this is actually soft rubber little piece. This is the part that goes inside of your veins. It's not going to poke through the bag. And we put that bag back in our little trash can here. And that's pretty much it. Apply a Band-Aid if necessary, and you're all set. The other option that we discussed is this one. I'll briefly walk through it real quick. So like I said, that one, the other style comes with this extension because it makes it easier for you to use with your hand. With this style, you can see it already has a pretty long extension. Same exact technique as before, and I find it to be much easier. Very simple on this one, and I'm not going to poke myself twice. But because you've got this long tube, it makes it a whole lot easier. So I go ahead and connect this. Well, first I drain the bag to get the air out of the line, and then I immediately connect the bag's hose to this before I even touch myself, so I don't have to deal with that whole tape and everything before from the other retractable ones. And then just like before, this little piece is going to stay inside of you. Same angle as before. You grab this little butterfly piece right here. This, of course, is connected to the tube, which does not have any water, or which does not have any air in it or water in it, because you've drained it all out already. You've locked it. And now this little piece here is just going to go right inside your arm, just like we did before. You can see it's a lot smaller, it's a lot easier. Can you see that right there? It's a lot smaller, it's a lot easier. Going to go into your angle, boop, down, and as soon as you do, this little hose is just going to fill full of blood like you saw the other one. So your little hose is going to look just like this. And that's what you want it to look like. That's how you know you've got a good stick and you're going to get a good flow. I know it looks like a lot of blood. It's really not. If I emptied all of this out, it would be one tiny little drop on the ground. But that's how you use these. Now, the reason that these aren't as popular in hospital settings is because nurses and doctors and phlebotomists and paramedics, we don't want to get poked by that with somebody else's blood. So what I do in the field is when I'm all done, because we're going to put this back in the bag, I save this little plastic piece right here so that when I'm all done, I can put that plastic piece back on, and I can take this and I put it in there and just give it a little poke, and that makes it nice and safe. So you can now put it back in that baggie and you don't have to worry about poking someone else with it. Last thing, of course, pack it in, pack it out. I can get you down here a little bit. You can kind of my workstation from before. We got all of our trash. Everything came in this bag. Everything goes back into the bag. Of course, as I missed my bag, of course, these are biohazards. This is your body fluids. You don't want to come into contact with anybody else. Grab all your trash, anything that you're going to reuse for later, obviously. This for the car ride home if necessary. Pick up all the rest of your trash. Pack it in. And pack it out. I hope this answers your questions. Like I said, I know it's a little intimidating to poke yourself the first time, but we've all had a shot or two in our lifetime, and we know that it's just that initial fear. It's really not bad, especially if it's a life or death situation. So I hope this keeps you safe, and I hope this keeps you healthy. God bless.